Hello, this is Dr. Peter Swanz with Vital Force Naturopathy in Carolina's Natural Health, and I apologize I've been away from the video blogs for a while. I started in January splitting my time between North Carolina and Louisville, Kentucky, and it's been a fantastic transition. I love seeing patients in both places, and I've just neglected my video blogs. But a couple things have come up in the recent news media that have made me want to jump back on really quick and share some information. And the first big one was an article, and it was in the LA Times, and it was called "No Yolk: Eating the Whole Egg is Dangerous as Smoking?" ? Right? And this was based on a journal publication that was done in Canada. And my problem here is that this gets put out, becomes mainstream newsworthy, and sends a lot of mixed messages. And as we go back and look at the original study, and this was a measurement and survey analysis looking at Canadians that were participating in a program for the prevention of vascular disease. The participants had already had some sort of vascular complications that qualified them for the program. So this means all of the participants that they were looking at had already had some version of a stroke or a mini stroke, right? So we can assume they weren't that healthy to begin with. Then they brought these participants in and they asked them, how much do they smoke, and also how frequently do they consume eggs. The median age was about 62 years old, and what they found, and then they measured the carotid artery thickness for plaque, and then they used analysis to find correlations between the smoking and the egg consumption, and they drew the conclusion that those people that smoked more or ate more eggs had a more thick plaque in the carotid arteries. And so just like that, smoking's bad and eggs are bad. And that's not really the case. And this is really a very bad study because the participants had all already had some sort of vascular complication. So I would imagine they weren't that healthy to begin with. And asking someone how many eggs they eat doesn't really take into consideration what kind of eggs are they. Are they grass-fed, organic, free-range eggs? Or is it an egg on a McMuffin sandwich from a drive-thru on your way to your stressful job while you're smoking your cigarette? We don't take into these other considerations. They mention in the study that they didn't take into effect waist circumference or lifestyle practices like exercise. So these could have been really obese people that don't exercise. They didn't get more detailed information about the general diet. How much fruits and vegetables do they consume? We know fruits and vegetables are beneficial for health. So it's upsetting to me because this research study, which is really all it was, doesn't warrant major publications in our newspaper and on the internet, and yet that's what it did. And I had at least 4 or 5 patients contact me the week after, Dr. Swanz, you tell us to eat eggs, did you see this study? And they did, and I did see it, and I was glad that I looked up and got this information and was really, it was quick to be able to share that with them. But we just need to be careful with the take-home message is we need to be careful with the information that's put out to us from the media, in newspapers, on blogs, in journals. There's a lot of mixed information, and research can be, really poor as a means for, a single study is a really poor means for drawing a broad conclusion. And then also, when we take multiple studies, we can actually have problems with drawing a broad conclusion. And there was a study looking at organic, non-organic foods, and I'm going to talk about that in a later video blog. But we just need to take everything with a grain of salt, and really, please believe me, free-range organic eggs are not a problem. I've yet to see them correlate with cholesterol. I've yet to see them correlate with heart disease. I want patients to eat them. Highly, highly recommend them. So please don't worry about the study. Email if you have any questions or concerns. We really want to talk to you about health and nutrition. It's such an important piece of your wellness puzzle. Thanks so much. This is Dr. Swanz. Have a great day.